My name's Isaac Miller. I'm a sports medicine physician here at Twin Lakes Regional Medical Center. My partner, Dr. Rogers, and I work at the Center of Orthopedics and Sports Medicine. When I was younger, there was a lot of interest. I had a lot of interest in different things. I would say two people had a big influence on me. One was an athletic trainer that I worked with in the high school whenever I was in athletics, and I thought about going into healthcare due to some of the stuff that he did with me, and then also my pediatrician, Dr. Joe Lee. I just thought he was one of the coolest guys in the world, and I wanted to do what he did, and that was kind of where it started. And then my love for science and the challenge of the job is kind of what led me to become a physician. You know, I've got a sports background, and so with that, you know, it gives me a little bit of a sense of team that you don't get when you're not on the team anymore, so to speak. So I like that avenue of it. And then it's also getting people to where they want to be, whether that's as an athlete where you've got an injury and you're trying to get back for the last game your senior year, or if you're that weekend warrior that has a marathon coming up in June and you're trying to get ready for that, or if it's just a worker at a factory or on a farm, making ends meet for your family. All those situations you got to be able to perform, and my job as a physician is trying to get you back to that level. So me and Dr. Rogers, we work together, but we do have different roles. As a sports medicine physician, a lot of what I do is non-surgical orthopedics, and so you know, there's some things that I can do with ultrasound and different types of injections and procedures that I've got some additional training in. Whereas my surgical partner, Dr. Rogers, you know, he excels in the OR, fixing things that we can't fix unless you have surgery. And so that teamwork that we have with one another, I think, works well, and that's kind of what sets us apart from each other. You know, the patient has to trust in what you're doing for them being in their best interest, and then also, as a doctor, a lot of times we're putting the trust in the patients that they'll follow through on some of the things that we think would be best for their overall health. And there's that conversation that you have with one another that's important, because if we're not on the same page, things don't work well. And so I think it's just having that relationship, building that rapport with one another so that we both are working towards the same goal. My family is important to me. My faith is also very important to me. We bought my grandparents the family farm, and so I spent a lot of time working on the farm, and I still play pickup basketball games and spend time with family and friends. That takes up most of my spare time.